If your ultrasound is normal, you don't have endometriosis. This is a very common misconception, but the science and current guidelines tell a different story, especially for women with painful periods and chronic pelvic pain. The reality is you can have endometriosis even if imaging looks normal. March is Endometriosis Awareness Month, so let's talk about this. Ultrasound is excellent at detecting ovarian endometriomas with greater than 90% sensitivity. Endometriomas are cysts on the ovaries caused by endometriosis. However, many individuals with endometriosis do not have an endometrioma. Ultrasound is moderately accurate for deep infiltrating endometriosis detection, but much less so for superficial peritoneal lesions, and this is the most common type. This means normal imaging does not rule out the disease. Early recognition is key to improving symptoms and quality of life. Endometriosis has a significant diagnostic delay, which on average is 5 to 12 years. The American College of Obstetricians and Gynecologists recommends that patients with persistent painful periods, despite over-the-counter pain medication and hormonal therapy, should be counseled about the high likelihood of endometriosis and offered discussion about the risks and benefits of a diagnostic laparoscopy, especially when other causes of chronic pelvic pain have been excluded. At least 2/3 of adolescents with chronic pelvic pain unresponsive to medical therapy will have endometriosis at laparoscopy. The benefits of laparoscopy are that it confirms the diagnosis of endometriosis and allows treatment with excision of lesions. The risks of surgery include those of anesthesia, bleeding, infection, and injury to surrounding structures, and the decision to do surgery is typically guided by the severity of symptoms. For example, whether pelvic pain is interfering with work or school, sports or activity, or just daily life. The bottom line is that normal imaging does not rule out endometriosis. Persistent symptoms deserve evaluation and thoughtful discussion with your gynecologist. If you or someone you know has ongoing pelvic pain despite normal imaging, don't ignore symptoms and advocate for care. Stay informed, be empowered, and live well.